A stroke is when the brain can't get enough oxygen. And so usually when we see a stroke happening, it's because one of the blood vessels in the brain is clogged. Comprehensive Stroke Center is just a designation that suggests that that hospital can perform the highest level of cerebrovascular care possible. So that is taking care of patients who are having strokes, being able to give clot-busting medications, being able to provide stroke thrombectomies. We use the acronym F.A.S.T to identify these signs of stroke. The faster we can get someone to the definitive level of care, the faster we can get them better. We've done a great deal of work in reaching out to our community, educating them about what the signs and symptoms of strokes are. And then we started reaching out to our colleagues in EMT. And we worked with them to identify who are the patients who are at a really high risk of having a stroke that needs that high level of care. Members of the fire department who were in our lecture within a couple of days of that, they identified this patient in the field, that this was a patient who would need to come to a comprehensive stroke center, and they brought her right to us. It was less than an hour after the onset of her symptoms that we had that blood vessel open and she made a complete recovery. And it was just so incredible because it gave that temporal aspect of, I just taught you this and it's a teach back. To those EMTs, thanks for listening. Thanks for internalizing that. Thank you for being able to identify that this patient was one who needed the level of care we're able to provide. And thanks for getting her so quickly to us.